When Public Health England, or the new JBC, identifies clusters that are linked to one another, that is defined as an outbreak, and a range of local and national actions may be needed. Decisions are taken through our Local Action Committee command structure. It works as follows. If PHE or the JBC spots a problem that needs attention, or the local Director of Public Health reports up a problem through the regional health protection teams, then the outbreak is assessed at the daily Local Action Committee bronze meeting. Issues of concern are raised to the Local Action Committee silver meeting, which is chaired by the Chief Medical Officer. And problems requiring ministerial attention are then raised to the Local Action Committee gold meeting. Yesterday, I chaired an emergency Local Action Committee gold meeting specifically to deal with the outbreak in Leicester. Unfortunately, while cases in most parts of the country have fallen since the peak, in Leicester, they've continued to rise. The 7-day infection rate in Leicester is 135 cases per 100,000 people, which is 3 times higher than the next highest city. Leicester accounts for around 10% of all positive cases in the country over the past week. And admissions to hospital are between 6 and 10 per day, rather than around 1 a day at other trusts. Over the past fortnight, we've already taken action to protect people in Leicester. We deployed 4 mobile testing units and extra capacity at the regional test site. We provided thousands of home testing kits and extra public health capacity to boost the local team. This afternoon, I held a further meeting with local leaders, with Public Health England, the JBC, the Local Resilience Forum, and my clinical advisors, followed by a meeting of the Cross-Government COVID Operations Committee, chaired by the Prime Minister. We have agreed further measures to tackle the outbreak in Leicester. First, in addition to the mobile testing units that I mentioned earlier, we'll send further testing capability, including opening a walk-in centre. Anyone in Leicester with symptoms must come forward for a test. Second, we will give extra funding to Leicester and Leicestershire councils to support them to enhance their communications and ensure those communications are translated into all locally relevant languages. Third, through the councils, we'll ensure support is available for those who have to self-isolate. And fourth, we'll work with the workplaces that have seen clusters of cases to implement more stringently the COVID-secure guidelines. Given the growing outbreak in Leicester, we cannot recommend that the easing of the national lockdown, set to take place on the 4th of July, happens in Leicester. Having taken clinical advice on the actions necessary, and discussed them with the local team in Leicester and Leicestershire, we've made some difficult but important decisions. We've decided that from tomorrow, non-essential retail will have to close. And as children have been particularly impacted by this outbreak, schools will also need to close from Thursday, staying open for vulnerable children and children of critical workers as they did throughout. Unfortunately, the clinical advice is that the relaxation of shielding measures due on the 6th of July cannot now take place in Leicester. We recommend to people in Leicester, stay at home as much as you can, and we recommend against all but essential travel to, from, and within Leicester. We'll monitor closely adherence to social distancing rules, and we'll take further steps if that's what's necessary. The more people follow the rules, the faster we'll get control of this virus and get Leicester back to normal.